Good morning. This is our scheduled Saturday morning yoga therapy class. This is our community service. We have been doing it for years and years and years through multiple avenues, starting in the temple, then in the peninsula, in OPC, finally in ascetic space before this coronavirus, now from home through this virtual online. Our topic and discussion every day is based on the science and philosophy of my book, which is called Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. And you can see there are two pictures of Albert Einstein and Rabindranath Tagore. Albert Einstein represents science, Tagore represents philosophy, and our present day statement is, when science meets a philosophy, it is our 21st century medicine. It is also our observation that when science stops, philosophy begins. Science is, you ask a question, you get an answer, it is science. You ask a question, then you get another question, another question. Essentially it becomes philosophy. But at certain part of our life, we can explain more scientifically the philosophy, that philosophy becomes science. And when you cannot explain the science, science becomes philosophy. The biggest example is Albert Einstein, famous physicist, famous scientist, but at the end of his life, he was a powerful philosopher. Today's discussion is yoga therapy for inner radiance. Radiance is called light. In yogic tradition, it's called Agni. Agni literally does not have an English meaning, but if you want to translate it, it could be a fire. And the origin of the fire, the name of the root where the word fire came from is a Latin word called ignite, and very close to Agni. So I'm going to go over with this philosophy today, and will show you the practices, and you will know what the Agni does to our body, mind and spirit. We call it a Sama Agni. Balanced Agni is the root cause of all of our health and healing. And a Sama Agni, the balanced Agni, creates Rogir Chikitsha, treatment of a disease or treatment of a patient, and Shasthrokha, maintenance of health. So what do we know about this Agni? Let's talk about a little bit of this Agni. Then I will show you the practices which ignites our Agni. We have 40 types of Agni in our body, and we'll talk about a little bit more and more. But our observation is that a person who is doing yoga, practicing yoga for some time, people will come and say, you know what, you looks like you are glowing. This looks like you are glowing. You have an aura around your face. And if you see the picture of most of our spiritual leader, you'll see there is an aura around our face. Interestingly, there is a lot of scientific research being done for Caribbean photography to capture this aura, but science could never prove this aura in a scientific manner. Still the work is going on. Same way when you do our pranayama practice called Kapalbhati Pranayama. Kapal is the forehead, Bhati is the light, or Bhati is the shining. When you do a Kapalbhati Pranayama, you remove all the toxins within your body. When you remove those toxins in your body, when you bring the fresh oxygen, a lot of physiological effect takes place. One of the physiological effect is called aerobic glycolysis. Our end product of metabolism is glucose. Oxygen combines with glucose, forms carbon dioxide, water, and ATP, adenosine triphosphate. This adenosine triphosphate is the energy which keeps us moving, keeps us awake, alert, moving. And this energy is also in the three types: catabolic energy, metabolic energy, and anabolic energy. In yoga and Ayurveda, remember one thing, yoga, Ayurveda is the same philosophy and same science. Its root is in the Vedas. And in Ayurveda we have psychophysical body type. Catabolic energy, the body type is called Vata. Metabolic energy is called Pitta. Anabolic energy is called Kapha. Psychophysical body type. Vata, Pitta, and Kapha. And the physiological effect we have called Prana, Teja, and Ojas. Prana is a subtle energy. It keeps us awake, alert, alive. Breath is not the prana. Breath is the carrier of prana. Metaphorically, breath is like your electric cable. Prana is like your electricity. In yogic tradition, our whole body, our every organ does a breathing, not only lungs. This prana, the life force, goes to the organ of healing and causes pranic healing. We call it a cellular communication. And prana flows through, called the nadis, the channels. Tejas, which is what we are going to discuss today, is called Agni. Tejas is the Agni. Tejas is a cellular intelligence. It is also more connected to Pitta. Prana is more connected to your Vata. And then the Ojas. Ojas is our cellular immunity. When you eat food, when food gets properly digested, we have 7 tissues called Saptadhatus, and after 7 tissues we form called Ojas. Prana, Teja, Ojas. And in practice of yoga, all 3 gets balanced. For the state of mind, mind also has a 3 state of mind. It's called Sattvic, Rajasic, and Tamasic. Sattvic is the purity of your mind. Rajasic is the activity of your mind. And Tamasic is the dullness of your mind. Agni is more linked to the Rajasic part of your mind. In a Western medical term, when you do the yoga practice, you develop a profound relaxation response you develop an activation of parasympathetic tone. When you develop the parasympathetic tone, you develop proper vasodilatation. The arteries, the blood supplying to the organs and different part of the body slowly and slowly opens up. The spasm gets released. You get a better perfusion of the organ. You get a venous return of an organ, so organ functions properly. Then with the proper activation of the parasympathetic tone and reduction of the sympathetic tone of our day-to-day fright and flight response, which is called stress, we get a better innervation, better function of an organ. So Agni, you can regard it from the Western medical perspective as a proper perfusion, proper innervation, proper function of an organ. Now let's come to the Yoga and Ayurveda philosophy, which is beyond science, but it is clearly felt in your body and mind. Remember one thing, a practice of yoga will create a change, which is, most of them are short time, but it will create a transformation which is permanent. And that transformation is felt within your body and mind, and there is no language to express yourself. Same thing is in the yogic and Ayurvedic philosophy. When I'm going to talk to you about the Agni, you will see that we can feel within ourselves with all the practices, and we cannot express. So this session is primarily dedicated to our yoga teachers, yoga therapy teachers, healthcare providers, long-term yoga practitioner who understands that the philosophy of yoga, who understands the 8 limbs of practice of yoga, who understands that yoga is a daily routine, dinacharya, who understands yoga is a lifestyle, it's a lifestyle medicine. So from yogic and Ayurvedic perspective, the Agni, the fire within my body, and the Agni is all being described in our body, mind and spirit, but at the level of the body and the mind, you look at where the Agni resides. The most important Agni is in our stomach. It's called the JATHAR Agni. It helps digestion of our food, and when it helps the digestion of our food, the food converts into 7 tissues called dhatus. Rashadhatu, plasma; Raktadhatu, red blood cell; Mamsadhatu, muscle tissue; Medodhatu, fat tissue; Astidhatu, bones and joints; Majjadhatu, nervous tissue; Shukradhatu, reproductive tissue, then forms ojas. Jathar Agni is the most important Agni. In Yoga and Ayurveda tradition, there is no concern about food. We said, we are what we eat. No, Yoga and Ayurveda says we are what we digest. You see what the people eat all over the world. We all talk about you have to be vegetarian, you have to eat this, you have to eat that. No, you need to increase your Jathar Agni. So we'll show you the practices. I showed you yesterday, like you're sitting in a Vajrasana Thunderbolt pose, activates your Jathar Agni. Mukhasan, frog pose. Shashankasan, Kapalbhati Pranayama. We'll be doing all the practices. We'll go through the one Agni at a time, and we'll show you the practices, how to ignite your inner radiance, the Agni. Kapalbhati Pranayama, Abdominal Lock, Udyanirban, Agni Sarkriya. These are all for your Jathar Agni. Then comes your Agni in your pancreas. It's called a Kloma Agni. This is responsible for your diabetes. And also remember, before I do it, whenever I sit down, I'm sitting down in a Sukhasan, putting my feet underneath my knees, keeping my spine straight, but I always balance myself. Remember, the whole yoga practice is a balance. It's called balancing of your body, mind and spirit. It's a non-dualistic, non-judgmental practice, and it brings the equanimity of both sides of the brain. So I'm right-handed, right-footed, I'm always using it. So what I'm trying to say, then you do change your foot, activate other side, bring the neuroplasticity to both sides of the brain. This is a request for me to all the yoga teachers, yoga practitioner, always do equally both sides. In yoga, left side of the body is a female energy, right side is a male energy. We all have the femininity and masculinity in us. So we balance that. It's very, very important. In a Kloma Agni, if you think about the pancreas is seated all the way to the back, very close to our vertebral body. So all the asanas we do called a spinal twist. Vajrasana, spinal twist, Ardha Matsasana, even standing, like you do a cat pose, Vajrasana, you do a Strasher, camel pose, you do laying down, all the poses like a Bhujangasana, Cobra pose, Locust, Shalabhasana. We'll show you, all this will activate your Kloma Agni. Liver has the 5 Agnis. It's called a Bhuta Agni. There are 40 Agnis. We'll count one at a time and we'll see, we'll end up with the 40 Agnis and we'll do some practice for each Agni. The liver has the 5 Agnis. Liver, if you massage the liver function gets better, Agni gets better. Kapalbhati Pranayama. Kapalbhati Pranayama massages your liver. Ardha Matsasana. Ardha Matsasana opens up your hepatic artery, hepatic vein. It also the side bend. When you do the side bend on the left side and the right side, there is a lot of studies today. I have all the evidence that you do ultrasound. Look at the ultrasound of the arteries and veins going to the liver, going to the kidneys, and main arteries which you can do ultrasound. You see there is improvement in the blood supply with the various yogic asana. Asana is called external and internal alignment. So you have now 7 Agni. Our thyroid gland has an Agni called JATHAR Agni, and thyroid gets balanced with your Ujjayi Pranayama. When you do Ujjayi Pranayama, we'll do the practice, I'll show it to you, but I'm giving you the concept first. Ujjayi Pranayama. Thyroid get balanced with a lot of asanas. You can do a Jalandhar Bandha, you can do your Brahma Mudra, turning your neck. You can do a fish pose, Matsasana, shoulder stand, Sarvanga Asana. It's called JATHAR Agni. Number 8. Number 9 and 10 is in the Agni in the cell membrane. When you have at the terminal cell membrane is called Pilu Agni, and the membrane of your nucleus is called Pithara Agni. Pilu Agni and Pithara Agni. So this is number 9 and 10. The cell and the cell membrane gets balanced, it gets ignited with your proper improvement of your lung function. What does it mean? So when a person is dying, what happens? They have a last breath, they expire. Today's discussion will be a little bit more, because this is a very extremely important subject and you will never see it anywhere written down in a book. That's what I'm saying. This one is for primarily for the yoga teachers. I'm sharing my knowledge and experience with you. So you improve when a person is dying and the last breath comes out, the lung stops, then the heart stops, then the brain stops, then all the cellular function stops. It's called cellular healing. So if you improve your lung function by a very simple, with a Bhastrika Pranayama, you do all the pranayamas, Bhastrika Pranayama, Kapalbhati Pranayama, Anulom Vilom Pranayama, alternate nostril breathing, Ujjayi Pranayama, Bhramri Pranayama, you'll see it improves your heart function, improves your brain function and the cellular function. So for Pilu Agni and Pithara Agni, you improve your lung function. And we'll go to practice one by one, and you will see how beautiful this concept, yoga therapy for inner radiance is. Then we have the 5 Agnis of our 5 senses. People who knows little Sanskrit and Bengali, Shabda, Sparsha, Roop, Rash, Gandha. Shabda is a sound we hear. Sparsha is the touch. Roop is what a vision I see. Rash is a taste. Gandha is a smell. Shabda, Sparsha, Roop, Rash, Gandha. 5 senses. 5 senses is controlled with a 5th limb of yoga is called Pratyahara. When you learn how to control your 5 senses. See, all the practices I have done so many times with you, so many of the practices, but what yoga therapy is called pick and choose these practices for different ailments, different conditions, different diseases, and today is a different concept of Agni. Those 5 senses we control with a bumblebee breathing, Bhramri Pranayama. Shut down your 5 senses, we create a sound, vibration, it's called a bumblebee breathing, Bhramri Pranayama. Then we have Agni for all of our 3 doshas, psychophysical body type, which you call a Vata, Pitta and Kapha, and there are 5 subtypes. There are 15 subtypes of your Vata, Pitta and Kapha. But primary practice is Vata is mobile. You do all the practices and Vata resides in the colon, all the asanas below your belly button, grounding asanas to balance your Vata. Pranayama, Anulom Vilom Pranayama, alternate nostril breathing, Vayu Mudra. Pitta resides in the small intestine, so all the asanas related to your belly button, Setuban Sarvanga Asana, Nokasan, boat pose, Bhujangasana, these are all for your Pitta, balancing and igniting. Remember, ignite in yogic tradition, basically it comes in a balance. Sama Agni, balance Agni. I'll describe you a little bit more about the definition of your health before you start the practice. For the Kapha, it's up in your stomach and up in the thorax and the sinuses, uplifting asanas. Again, for Pitta, the pranayama will be cooling, Sitali Pranayama. For Kapha will be your very rapid, fast Bhastrika Pranayama. So now we have 10, 15 and 15, 30. We have 30 Agnis now. Then we have 7 Agnis for 7 Dhatus. The 7 Dhatus are again Rasha Dhatu, Rakta Dhatu, Mamsa Dhatu, Medu Dhatu, Vasti Dhatu, Majja Dhatu, Shukra Dhatu. 7 Dhatus. All of them has an Agni, and those Agnis are primary gets ignited when you ignite the JATHAR Agni. So all the practice of JATHAR Agni will also affect the Agni of your 7 tissues. Comes 37, 3 more Agnis. Agnis of your excreta, Agni of your malas, Agni of your elimination of the stool, Agnis of your urination, and Agnis of your sweat, perspiration. For proper elimination of the stool, it's your Matsasana, squatting pose and drinking a glass of water in a gulp. It starts your peristalsis, it creates a gastrocolic reflex and a proper elimination and proper Agni for your malas. For your urinary issue, to have proper function of the bladder, prostate, you can do called a bandha, called a mula bandh. Root lock is very important. Kapalbhati Pranayama, very important. Varun Mudra. Varun Mudra is for bladder function, very important. And for your sweating, mala is the excreta of your prana. When prana gets properly metabolized and prana flows properly through your channels, you develop proper elimination of perspiration. It's called a nadi shodhana. Channel gets cleaned up. So how the nadi gets shown up? Nadi shodhana is done through your alternate nostril breathing first, and also with a little breath holding. Beautiful concept. You'll never find it in any books, never find it at one place. So this is my gift to all the yoga teachers for you to use it in your practice. A definition of health comes up. It is in Sanskrit, but I'll tell you a little bit in English. Samadosa sama agnika samadhatu malakriya prashunna atta indriyaman shasthu iti abhidhayate. Samadosha, balance doshas, balance in our psychophysical body type, balance in our vata, pitta and kapha. Samadosha, sama agni, balancing our agni, the one we are going to do today. Samadosa, sama agnika, ka means and. Balance doshas, balance agnis, and samadhatu malakriya. Samadhatu means, samo means balance, dhatu is the tissue, 7 tissues. Balancing the 7 tissues. Malakriya, kriya means action, mala is your elimination. Proper elimination of your stool, urine and perspiration. Samadosa, sama agnika, samadhatu malakriya, prashunna atma. Prashunna is content. Atma is your soul. Soul is content. Prasanna atta indriya mana. Indriya means 5 senses. Shabda, sparsha, roop, ras, gandha. Sound, touch, vision, taste and smell. 5 senses connected to your mind. Mind is the content of your 5 senses. Prashunna atta indriya mana shasthu iti abhidhayate. This is the definition of health. There is no body has ever challenged this definition of health, because this definition is in a non-dualistic, non-judgmental, in a yogic oneness. WHO has defined the definition of health. It is also around in 1948-49, and nobody has ever changed it. Health is a balance of the body, mind, later on the spirit was added, and not necessarily the absence of disease. Okay, JATHAR Agni. So for the JATHAR Agni, the first asana practice you'll be doing is your Vajrasana. In a Vajrasana, you sit down on your heel. So if you have a problem sitting it down, what you can do, initially, you can do a few things. You can have a little bit of a folded towel, a bolsters, whatever you use at the beginning. At the beginning, you can start sitting on your heel like this. This will help a lot. This is the beginning. If you cannot, you put a little bit of a put underneath, you will have a profound level of relaxation. Slowly and slowly, you will drop it down. And again, if you cannot sit down like this, just put it underneath. I like a folded blanket because in a folded blanket, what happens? You can take out the one layer at a time. Because you'll come to the same spot here, because that is called your neuroplasticity. This is one asana we do in our full stomach. Remember, all the asana practice we do in our empty stomach. A lot of people ask me, when do we do yoga? Empty stomach. First thing in the morning. It's a dinacharya, daily routine. I have to do it in the afternoon. It's fine. Give about 2, 3, even 4 hours after a main meal. And I hear this question all the time. In the morning, I have to have a cup of coffee before I start practice. Please have a cup of coffee. You know what will happen? When you have your eyes closed and you're trying to do a Mudras or a Shashankasana or a Vajrasana, when eyes is the only thing you will see, a cup of coffee is going in front of your eyes. Don't deprive your mind. We are a human being. We'll never be in a state of oneness. In empty stomach, to ignite your Agni, you will do the Gomukhasan. So remember, if you look, you come to my classes every day, every Saturday, this is called your Adhi Mudra, called a baby fist. Take the thumb inside and close. What it does, it relaxes. Remember, what is the Agni? Agni is your proper perfusion, means proper blood supply and proper blood drainage of an organ, proper perfusion. Proper perfusion comes from relaxation response. More and more body and mind is relaxed, you will have a better and better perfusion to the organ. More and more you have a relaxation response, you will have a better and better your innervation and function of an organ. So put it at a level of the belly button, keep your spine straight, look straight here. The best way to get spine straight is look straight. And always you breathe out first in yoga practice, because lung is like a balloon. You need to empty it first. Take a deep breath in, completely blow out, suck your stomach in a little bit, and slowly come down with a normal breath. Remember, do not hold your breath, your normal breath, breathing out longer than breathing in. And what you're looking for, first pain. If you feel any pain, you back off. So I can go down right away, but I'm showing you how to do it in stages. A beautiful yogic statement, in stages, impossible become possible. Next is your breath. Annamaya kosha to pranamaya kosha. Any imbalance you create in your physical body will show up in your breath. So if my breath is effortless, I'm talking, I'm singing, I have no pain, and my breathing is exhalation longer than inhalation, I come down, all the way down, and stay here between 5 to 10 breaths. I practice every day, and I practice 5 to 10 breaths. And I'm going to show it to you. I'm going to show you slowly, one at a time. Vajrasana, Thunderbolt, Gomukhasan, your frog pose. Then remember, quieting down your mind and body ignites your Agni. Shashankasan. Shashankasan, take your hands all the way high up. Put your hands all the way down. Drop your elbows down, head down. Rabbit pose. Very slowly get up. Let's do then the most important of your igniting JATHAR Agni will be your Kapalbhati Pranayama, Uddiyana, Abdominal Lock, and Agni Tejas. You can do it sitting in this Vajrasana, it's fine. You can do it sitting in a chair, or even sit down next to a wall. Sit down. Actually, for a pranayama practice, you need called Merudanda Achal Manasthit. So best way to do Merudanda Achal means spine straight. Sit against a wall. If you sit against a wall, it always keeps your spine straight. One thing will happen to you when you are doing the pranayama practice, you will get some relaxation of your muscles of your back, paraspinal muscles. This is also another interesting concept. Pain fibers are all in the ligament and the muscle. When the muscle tightens up, your pain fiber gets activated. When the muscle tightens up, you feel pain. On the same way, you are used to with the muscle tightness in my back. Remember my skeleton always go in the front. All the muscles on the side of my spine, it's called paraspinal muscle. It's keeping me up. I'm used to with that tightness in my muscle. Now, when a muscle starts to relax, what an opposite concept. You still start feeling some pain because you're not used to this relaxation. You feel it uncomfortable. So, sit against a wall and do pranayama practice. So, all of you have done the Kapalbhati Pranayama with me. So, you can sit down comfortably in a Sukhasan, Siddhasana, Padmasana. If in a Sukhasan, you put your feet underneath your knees. And always remember to sit one side, you always cross your feet, sit on the opposite side. You're practicing with me, you can do with me. Next, you can go from Sukhasan to the Siddhasana. Take the heel all the way to the back. Take the other heel on the top. Your other knee will drop down. So these are in stages. Remember, these relaxation are also activating your inner radiance, the Agni. I hear it all the time. And whether it is a compliment or not, oh, I have not seen you in a long time, but now you look younger, you look glowing, look at how good you look. But that is for everybody who is doing a daily practice of yoga. Take my foot again, which I showed you all the time in stages. Take my other foot here. Always listen to your pain. If you get a pain, you back off. Listen to your breath. The breath is not effortless, you back off. So I don't have any pain, I'm putting it here. Ardha Padmasana or Swastikasana. I stay here a little bit longer. Now this is the higher bit. Let it be here. If you push it down, you come back like here. What you do? Close your eyes, do your breathing, breathing out longer than breathing in, and this thing is going to happen. Go to the opposite side. Very nice way. Go to the opposite side. Ardha Padmasana, Swastikasana. After a short time, when you feel the relaxation response, always a little smile in your face, completely effortless breathing, you can easily, very easily get into Padmasana, lotus pose. Padmasana will ignite your JATHAR Agni, as simple as it is. All of you have done Kapalbhati Pranayama. So Kapalbhati Pranayama will be very good to ignite the JATHAR Agni, ignite the Kloma Agni. The Kloma Agni is the Agni in the pancreas, but Agni in the pancreas gets more ignited with your spinal twist. Vakrasana, Ardha Matsasana, Padahastasana, forward bend. Chakrasana, go to the back, Chakrasana, the back bend. Tirjaktadasana, doing on the side bend. Tirjaktadasana, the side bending of your spine. These are all for your Kloma, for your pancreas. In a Kapalbhati Pranayama, you have one balloon here, with the center at the belly button. There's a diaphragm here, another balloon here. This balloon is full of all the toxic material. I have a friend who's a cardiologist. He explained to me about Kapalbhati Pranayama one day. Beautiful explanation. He told me we have all the excreta, all the toxins, all the poisons in our body comes out. And all the food after proper digestion, it comes out as a stool. All the water and fluid intake after proper digestion, it comes out as a urine. All the prana you take, all the prana after proper metabolism, it comes out as a perspiration. You know that sweat, perspiration is the mala of your prana. But here is some toxin sitting in the lung, which is carbon dioxide and other gaseous substance, which can remove voluntarily. Stool, urine, perspiration, it has a lot of autonomic connection. But you also know that yogis have a good control over autonomic nervous system. They can always control themselves. We can always control our, like a morning bowel movement. Wake up in the morning, we'll sit down in a malasana, drink a glass of water, immediately we get developed a urge for a bowel movement. Why? We've been doing it repeatedly. Neuroplasticity sets in. You have a voluntary control over involuntary function. You have a control over your autonomic nervous system. So able to remove the toxins voluntarily is your Kapalbhati Pranayama. When you remove the toxins, the Agni ignites, Kapal becomes a bati. There is a light around you. You do not do any breathing. Your awareness in the belly button. You push the belly button to the back. You reduce the size of this balloon. It hits the diaphragm. It hits the balloon here, and the air comes out. So here my hand, if you're new to the practice, my hand will go very slow, 1 per second. And you see, I have not done anything in my breathing. All the practice I do pranayama, I have my eyes closed, I keep my spine straight. This is the most important pranayama to ignite the JATHAR Agni, the Kloma Agni with pancreas, and the Bhuta Agni, the 5 Agni in your liver. So these are all comes up, almost 7 Agnis you are going to ignite with one practice. Pranayama, control, restraint of your prana. So it is done with your mudras. Mudras are called psychophysical connector of moving your prana to the organ of healing. Dhyana mudra or Jnana mudra quiets down your mind, controls your pitta. Index finger down, Vayu mudra quiets down your Vayu, Vata, controls your pain. Shunya mudra, middle finger and thumb, improves your hearing. Kritibi Mudra, ring finger grounding, balances your kapha, very good for people with diabetes and truncal obesity. I get so much request, please do a session on truncal obesity. We'll talk about the concept of truncal obesity, and you'll see whatever you are doing is going to reduce your truncal obesity. Varun Mudra, the water component and the fire, because of all the 5 elements, space, air, fire, water, earth, on my hand. Controls your bladder function and the fluid in your body. Skin, radiance of the skin. People all do all kinds of skin treatment. Skin health comes from within, healing from within. So all the blood vessels under the skin, if they're tight, skin doesn't get enough blood supply and they develop all kinds of skin problems. But when there is a vasodilatation, it's called peripheral vasodilatation underneath your skin. The skin has the Agni, skin is glowing. Ring finger, little finger and thumb. Shakti Mudra, Prana Mudra, improves your strength. Middle finger, ring finger and thumb, Apana Mudra. Pachan Mudra, controls all the amas in your body. Put the index finger down, Apana Vayu Mudra, Hridaya Mudra, improves your heart. Put the fingers together, Linga Mudra. Prana Mudra, Ganesh Mudra, Agni Mudra, Shankha Mudra. Okay, generally we do about 5 or 7 mudras, do about 10, 15, maybe 20. I do generally 50. When I close my eyes, I'm doing Kapalbhati Pranayama. When you start doing it, you do only effortlessly. Beginning you may do only 30 seconds. It's good enough. How do you need effortless? You can talk. You can sing. Very, very important concept. Slowly, your goal is between 5 to 10 minutes, or maybe a little longer. But not on the first day, not on the first time. It is not a competitive, it is a competition within yourself. Your mind. Remember, whole concept of yoga is beyond science. It is not in the motor or sensory cerebral cortex. It is in the limbic system, the emotional brain. It is in the amygdala. It is in the hippocampus, the area of our emotions, prefrontal cortex. Let's start with the mudras. You continue doing it, and I'll tell you the benefits. You don't stop, but I'll let you the benefit. Touch your index finger and thumb, putting here. Bring your awareness to your belly button. Slowly, 1 per second. Another thing I hear all the time, what happens when you do rapidly? When you do rapidly, completely effortlessly. If you do the rapidly with the effort, you get opposite effect. Instead of parasympathetic activation, sympathetic activation, your blood sugar goes high up, blood pressure goes high up, heart rate goes high, you're in a miserable situation. But when you go very rapidly with an absolutely effortless ease, that is called a kriya, shodhan kriya, sharir shuddhi, cleaning your physical body. Agni Deepana takes place when you get a mana shuddhi, mind gets clean. Atma shuddhi, the spirit gets clean. Sharir shuddhi, mana shuddhi, atma shuddhi. Let's start again. Bring your awareness to your belly button, push it in the back. Change your mudras. Keep on doing Kapalbhati Pranayama. Let's do 10 in each, just for the practice sake. It massages your liver. It massages your stomach. Massages your spleen. Massages your pancreas. Massages your small intestine. Massages your large intestine. For women, it massages your uterus, massages your tubes, massages your ovaries. For men, it massages your prostate. Shunya Mudra. All the disease we have today, after all, your vital function is in your abdominal cavity. And the Sanskrit word is called JATHAR Parivartan or Udarkarshan. Keep doing it. Let me tell you the benefit. Udarkarshan. Udar is the stomach, Karshan is the massage. It also massages your diaphragm. Diaphragm is supplied by a nerve called a phrenic nerve. It comes from these cervical areas. So remember one thing, the nerves has a both called efferent and efferent. Efferent means admit, A. The signal goes up to your brain stem or your brain. This is called your admit, sensory. Efferent, E. Efferent is expelled. The signal comes out from your brain and brain stem, or your spinal cord, that's called motor function. Diaphragm, very important. Activates. Keep on doing it. Don't stop. Let me tell you the benefit. Change your finger. This is your Kritibi Mudra. Ring finger and little finger. Earth element and a fire element. Normally breathing is both voluntary and involuntary. I'm sleeping, I'm breathing. That's a function of your brain stem. We call it a lower part of the brain. We call it a lower chakras. The lower chakra is very important. Animal instinct. Power, procreation, control. Fourth chakra is a transition. Anahata chakra is a love. Vishuddha chakra, communication. Agna chakra, spirituality. Shastra chakra is a bliss. So the brain stem is your unconscious mind. But consciously, when I'm conscious, I can do deep breath in, that is a function of your cortex. Change your mudras. Varun Mudra helps in your bladder and the fluid and the function of your skin. So breath is a connector between your conscious and subconscious. You can call it a brain, and when the function comes, you call it a mind. It is a control, voluntary control over involuntary function. Able to do the control your breathing, pranayama means prana, control, restraint. You learn how to control over your autonomic nervous system. Yogis can slow down their heart, yogis can stop their breathing because they have a control over autonomic nervous system. Prana mudra, Shakti mudra, little finger, ring finger and thumb. It also massages your lungs, lower part of the lungs. So the air is coming out through my nose. So I'm breathing unconsciously in between this active exhalation. It's an active exhalation. I'm exhaling actively. This is my exhalation. My exhalation. Exhalation. I'm not doing my exhalation. My awareness is in my belly button, and I'm pushing the belly button to the back. But I'm breathing in between without knowing. Why? The day I was born, I took a deep breath in. Nobody taught me how to breathe in. Apna mudra, middle finger, ring finger and thumb. So all the toxic material content from the lung is coming out. Voluntary removal of toxins from my body. It will rejuvenate you. You will be disease-free, medication-free, enjoying a good quality life. Medications are controlling you through the control of your reflexes. They're called pharmacomafias. When you learn how to do a voluntary control over involuntary function, your meditation is medication. Our mind can produce any medication you are taking. You don't need any medication from outside. It is called healing from within. Put the index finger down, it is called Apna Vayu Mudra. Good for your heart, good for your pulmonary function. When it is massaging the diaphragm between the lung, the organ is the heart. It's also massaging the heart. In yogic tradition, when you do the massage, the organ gets better. So it is basically a very slow massage for your heart, and it is exactly a counterpart of your called chest compression, called cardiopulmonary resuscitation. When your heart stops, we start creating the chest compression, which is massaging your heart. This is, we call it internal CPR, internal cardiopulmonary resuscitation. Don't do it forcibly, very relaxed way, very gently. Will support your cardiac health. Very important pranayama. It is called your metabolic pranayama, and it's called an Agni Pradhan pranayama, igniting your Agni. Next one is your Uddiyana, abdominal lock. There are 3 locks called chin lock, abdominal lock, and a root lock. Chin lock will help with your thyroid function coming down. We'll do it next when you do the Agni for your thyroid, called JATHAR Agni. Let's do it for the JATHAR Agni, Kloma Agni, and Bhuta Agni. Agni for your stomach, Agni for your pancreas, Agni for your stomach. Always breathe out first. Always breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. Abdominal lock, Uddiyana Bandh. It increases the negative intra-abdominal pressure. When the intra-abdominal pressure becomes negative, you get a better perfusion or better blood supply, better venous return to the abdominal organs. Creates a negative pressure. People with hernia wants to come out with a increased abdominal pressure. Hernia needs to have an operation because it's a hole which comes out. Hole needs to be closed. If it is very early and a person who doesn't want the operation, we tell them you can practice like this abdominal lock, the Uddiyana Bandh for your early hernias, or if you're not interested to have operation done. Next, igniting your Agni, or the inner radiance, is your Agni Kriya. You create your abdominal lock, you're in extreme state of relaxation, then you massage all the internal organs with abdominal wall. You can go a little farther, doing a Kriya called a Nauli Kriya. Then you have a right Nauli, left Nauli. We have a lot of yoga teachers I've seen in their Facebook posting. They do the excellent Nauli. And the person who is always showing Nauli in the television screen is our Swami Ramdev. Swami Ramdev does a beautiful Nauli Kriya. So let's do the Agni Kriya. Let me show it to you how to do it. Again, in the yogic tradition, breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and move. Remember, these are effortless practice. Do not make any effort that I need to do 50 times and 100 times, 200 times. You can talk, you can breathe. That is good enough. Okay, let's show you a couple of more asanas. See, we're doing asana pranayama practice. You know why? Because this is, people ask me all the time, especially yoga teachers. We have the Ashtanga Yoga, Yam, Niyam, Asana, Pranayam, Pratyahara, Dharan, Dhyan, Samadhi. You do asana first, pranayama next, then you slowly enter into a pratyahara. Pratyahara, pratyahara is a reject, ahara is an intake. All the input you have through your five senses gets totally controlled. It's like a turtle putting the head inside. The dharana is the focus, the dhyan. But in yoga therapy practice, every asana is a savasana. Every asana is an effortless ease. Every asana is effortless ease, and every pranayama is a totally effortless pranayama. So for your Kloma Agni, for the pancreas, you want to do first a very nice spine straight. This is Dandasana. Keep your spine straight, feet in the front. You relax your toes, separate your toes with your breathing in and breathing out. Just relax a little bit of your ankle joints, breathe in, breathe out. Do a little rotation of your ankle joints. I do it a lot more, just for you do it's called a windshield wipers. Then you do both the legs in a very relaxed way. A very powerful asana for ignite your Kloma Agni in the pancreas, Bhuta Agni in your liver, JATHAR Agni stomach, Paschimuttanasana. Take the hands all the way wherever it goes. Goes to your toes is great. Keep your spine straight. Look straight. Slowly bring your body down. We've been doing so long, we can put out both the hands. We can clasp the hand. Clasp the hand. Remember, look for it. What is that? No pain. No pain and effortless breathing. When you have effortless breathing, you slowly come down and stay in the posture and have your 5 to 10 breath, breathing out longer than breathing in. And get up, should get up very slowly, one step at a time. Paschimuttanasana. I'll show you a little bit, one at a time, but I'm telling you, giving you the concepts, you can do it more at home. And this thing will be recorded. This thing is recorded in the Facebook, and this will be uploaded in the YouTube, so you can always look at back again, review it, and do it for future practice. Vajrasana, spinal twist. Take the right foot next to the left thigh. You are very relaxed, so the right knee starts to go towards your left side. Left arm comes outside your right knee. The right hand goes all the way to the back. Left hand is up here. Slowly it drops down, touches your knee. Breathe out first. Take a deep breath in and slowly turn your body and follow your breath. If your breath catches, you back off. Find a place where you'll be able to breathe in and out longer than breathing in. And stay here between 5 to 10 breaths. Slowly relax. Always balance it to the other side. So spinal twist. Spinal twist will be your igniting Kloma Agni. Pancreas. So what will be good for? Diabetes. People with diabetes needs to increase the Agni in your pancreas. In Western medical term, it needs to massage the pancreas so it can release more insulin. So again, left knee, relax enough, comes towards your right side. Right arm will come outside your left knee. Left hand goes to the back. Right hand stays high up. Slowly goes, touches your knee. Breathe out first. Take a deep breath in. Slowly turn your body and find a spot where you can stay completely effortlessly, breathing out longer than breathing in, between 5 to 10 breaths. When you close your eyes and do the practice, slowly you will see that your body and mind connects together. That is yoga. Yoga is a union of your body and mind. You can put one knee in the top of the another knee. This is like a beginning of your Gomukhasan. Gomukhasan is also a very wonderful relaxing asana, and in fact Gomukhasan ignites inner radiance of all of your Agnis, the 40 different Agnis. But we are going practice one Agni at a time. We're all concentrating in the first 7 Agnis inside your stomach. Next one is Ardha Matsasana. There is no English translation. There's always translation. There is we call it lost in translation. It's okay. So this is my left knee. My right foot comes outside your left knee. Right knee goes all the way out. So left goes outside. Right hand goes all the way to the back. Hand is up here first, slowly comes down, touches your knee, touches your ankle on the other side of your foot, right foot. Same way, breathe out first, deep breath in, and slowly turn your body all the way to your back. Seven to 10 breaths. Oh my God, look at that. Clock is moving fast. Okay, so just to show you the practice, you need to do also the other side. Let me show you a little bit more practice because we need to cover all the Agnis in next few minutes before we finish our class. So remember Spinal Twist, all the asanas you know. So we'll be doing a back bend, and back bend always do a supported back bend. Go slowly back into a wall, put your hand in the wall and slowly walk your hands down. And if you see my yesterday's class, which was in Bengali, I showed them very clearly how to do back bend. And also in the forward bend, also, what you do, if you can see, can show it to you, so you'll do it. When you come down in the forward bend, you always support or supported forward bend. In an unsupported forward bend, you create some more aches and pains in your lumbosacral area. Here, and slowly it will come down. And also, if you see from a profile, you'll see my hand is here, my hand is supporting in the ground. Slowly my hand is coming on the side. My head is coming close to the knee. I can put my hand underneath the heel. Keep my knee straight. Do not bend your knee, and head will come towards your knee. Padahasta. You can do all supported forward bend, all supporting, touching your head on a small table or a stool. It's a wonderful practice. You can do a lateral bend, like you can clasp your hand, breathe out first, take a deep breath in, go to the one side, close your eyes, breathe in and out, and get a profound relaxation. Again, come back in the middle, do the same thing, breathe out first, take a deep breath in, Number 8 Agni is your thyroid, JATHAR Agni. Thyroid Agni gets more balanced and activated to Ujjayi Pranayama. Ujjayi Pranayama is in the larynx, And Ujjayi Pranayama, the larynx is supplied by your superior and inferior laryngeal nerve. These are come from the branches of the vagus nerve. It is a very gentle, relaxing closing of your larynx. Try to breathe in, which will make a sound, and then what you do, you incorporate in a relaxing state a abdominal lock, Uddiyana Bandha. You'll see when I'm doing the Ujjayi Pranayama, we'll have abdominal lock. With the abdominal lock, then you will also incorporate a chin lock. Slowly bring your chin down, touch your chin to the chest. It massages the carotid sinus. The carotid sinus creates a profound relaxation response. Then you end with a left nostril breathing, which is called Chandravedi Pranayama or cooling Pranayama. This is a sequence of events. Next one for the thyroid, for the Agni, you can do all the asanas like a fish pose, Matsasana, you can do Strasher, Camel pose, you can do Sharvanga Asana, the shoulder stand, but the powerful tool is your Brahma Mudra. Brahma Mudra is a rotation of your neck in the four posture with a Bhramri Pranayama. Bhramri is a bumblebee breathing. So let's do a Ujjayi Pranayama and a Brahma Mudra with a Bhramri Pranayama. To breathe out first, and always in the hands, you do the Adhi Mudra, that's a very relaxing mudra. Breathe out first. Take a deep breath in. Completely breathe out and starts to project. Wonderful practice. Ujjayi Pranayama with a abdominal lock, Uddiyana Bandha, chin lock, Jalandhar Bandha, and left nostril breathing, Chandravedi Pranayama. Once you practice that, all the imbalance of the thyroid gland will go away. People ask me, I have a hypothyroid, I have a hyperthyroid. The yoga doesn't look at hypo and hyper. Yoga looks at the imbalance. Bring the balance back. Same as like autoimmune disease. People ask me autoimmune disease. It's an imbalance of your immune system. You bring the balance back. Do the balancing poses. Do Umlum Vilum Pranayama. Like here sitting down, just change your foot. This is good enough. Create the balance here. So let's do the Brahma Mudra, the four postures of your neck, and with a Bhramri Pranayama. So when you breathe out, you'll have a sound of a bumblebee. So hand is in a Adhi Mudra. Breathe out first. A deep breath in, slowly put your neck to the back. And breathe out with a bumblebee breathing. When you come down, you look for your pain and effortless breathing. One thing will happen to you, since it's happening to me, I'm almost hour and a half, I'm doing the practice. I don't eat any, drink any water, I have a saliva in my mouth. Saliva in your mouth tells you you have a parasympathetic activation. On the both the sides, breathe out first, take a deep breath in. Turning the neck all the way to the back. Breathe out first. Deep breath in. Wonderful practice for your JATHAR Agni. Cell membrane Agni, Pilu Agni, and the covering of your nucleus, Pithara Agni. As we described, improve the function of your lung. If you improve the function of your lung, improve the function of your heart, improve the function of your brain, then improve the function of your cells. Your Agnis gets ignited when your lung function gets better. And the best way to remove, remember, lung is like a balloon. It has a 4.5 liter capacity, or vital capacity. We only breathe only 0.5 liter, 500 cc. So you need to remove all the toxins. Active exhalation, active inhalation, it is called your Vastrika Pranayama. We have done all the Vastrika Pranayama, all different ways, like you breathe in, when you balance it, you breathe in from here, breathe out. One very nicer way to do it, with pulling it down with your Adhi Mudra in a slow pace, medium pace, and a faster pace. It literally improves the lung function. For me, if I go for a pulmonary function test, which is called, very interesting, pulmonary function test is called spirometry. Word spirit, the root word for the spirit is the breath. I'm spiritually connected with you. I'm connected with you through my breath. Whatever I'm breathing out, you're breathing in. Whatever you're breathing out, I'm breathing in. Spiritual connection, spirometry. When you do the Kapalbhati Pranayama or you do the Vastrika Pranayama, all the parameters they set up to do your pulmonary function test, you will go beyond that. Generally we do a slow 20, medium 20, and a faster 20 as a one cycle. Then you repeat the cycles, 1 cycle, 2 cycle, 4 cycle, 8 cycles, as much you can do completely effortlessly. Okay? If you don't, let's just do one cycle just to show it to you how we do it. Then you do it at home more to improve the cellular function. It's called cellular healing. Igniting the cellular Agni, Pilu Agni and Pithara Agni. This will be number 9 and number 10 Agni. Hands high up, very slow movement. Breathe out first, active inhalation and exhalation, pulling down slowly. Medium pace, 20. Rapid speed, 20. One cycle of Vastrika Pranayama. Still talking, I'm breathing, I'm totally effortless. Now I take a deep breath in and breathe out. It's a wonderful practice to initiate a cellular healing. If you go to my YouTube channel, you'll find all of them I have done before, called Yoga Therapy for Cellular Healing. A lot of other practices we have, but we are showing the basic practices by which you can ignite the Agni. People always come to me and say, can you show me the practice for diabetes, practice for hypertension, practice? I say, why? Why don't you go ahead and take some medication? Take metformin, the blood sugar will come down. Oh, no, I don't want to take a medication. You don't want to take a medication? Adopt a yogic lifestyle. Adopt a yogic daily routine. I did a program yesterday, it was Bengali called Yoga Therapy, the healing from within. Healing from within. You heal your 3 bodies, 5 koshas, 7 chakras. Maybe we'll do another session. Maybe we'll do the next session. Yoga therapy to balance 3 bodies, 5 koshas and 7 chakras. Next Agni is your Agni of your mind. What is your Agni of your mind? Your mind is your 5 senses. Shabda, Sparsha, Roop, Rash, Gandha. Shabda is your sound, hearing. Sparsha is your touch. Roop is your vision. Rash is your taste. Gandha is your smell. They can all balance with the Brahmari Pranayama. So we shut down our 5 senses. We always breathe through our nostril. Always remember, always breathe through your nostril. When you breathe through your nose, the air goes through your nose, the air gets first filtered. Nose is like your personal air conditioner. Outside the air is warm, it cools it down. Outside is cool, it will warm it up. It goes to the side of the nostril. There is an organ called a turbinate. Turbinate has some, it's like a ridges, it guides the air, goes into your larynx. And in the process also, it secretes from the sinus mucosa a substance called a nitric oxide. Nitric oxide is a very potent vasodilator, opens the blood vessel, and it also acts on your endothelium, inner lining of the blood vessel, It secretes cyclic GMP and also secretes acetylcholine, which is a activator of your parasympathetic tone. If you breathe through your mouth, you don't know where the air has gone to your stomach, through your esophagus, or through your larynx to your lung. If you have to breathe through your mouth, you can breathe in through your nostril, breathe out through your mouth. That is more physiological. It's a wonderful practice. I get a profound level of relaxation. Let's do two Brahmari Pranayama. Index finger, forehead is a 3 fingers to close your eyes, thumbs to close your ear and close your mouth. Breathe out first. Take a deep breath in. Slowly take your both hands, palming and cupping. Rub your hands, rub your hands. When you feel the warmth of both of your hands, if you're wearing glasses, remove your glasses. Take the hands like a cup, put it over your eyes. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face. Then massage behind your ear, massage in front of your ear, massage your tragus, the external auditory canal. That is your auricular branch of the vagus nerve. It activates the relaxation response. Massage your carotid sinuses here, massage the back. So wonderful to activate and balance your 5 senses. Remember mind, Manomaya Kosha. Mind is a content of your 5 senses. When your content of the 5 senses gets more processed, we call it a more digested. Remember in yoga and Ayurveda, there is no separation between body and mind. Body can digest food and mind can digest thought. And all the thought you remember, you live in present. You live in present. Yesterday is a history. Tomorrow is a mystery. Today is the present, it's a gift. And always stay above your body, stay in your mind. Duality comes in the body. Non-duality comes in your mind. Very important concept, yogic concept. Hold the practice of yoga. You'll feel oneness. When your Agnis are ignited, you feel your body, mind and spirit is in a state of health. Called Shastho, Sanskrit, Shasthi. Sha is the self. Your self stays stillness. Body likes movement, mind likes stillness. If you read something, if you see something, keep your mind still. Very, very important yogic concept. So there are 15 Agnis. Next 15 Agnis are the Agnis of your doshas. Vata, Pitta and Kapha. Vata had 5 subtypes. Pitta has 5 subtypes. Kapha has 5 subtypes. This is going to be a whole practice. In fact, I have done it already. It's called yoga therapy, called Ayurvedic yoga therapy. How to balance the Vata, Pitta and Kapha. Maybe we'll do it, present it again. But let me just give you a little concept instead of just a practice, so get a little bit of understanding. The Vata, the primary element, is a movement, it's a mobile. And Vata resides in the colon. Pitta, the main attribute, is your fire, is the heat. When you balance, you get very angry. And Vata, when you get very imbalanced, you get very anxious. And resides in the small intestine. Kapha, which is your very grounding, water and earth element. Immobile, stillness. They need movement. They reside in the stomach. Stomach, small intestine and colon. So for asanas, any asanas below your belly button, grounding asanas to balance your Vata and Vata subtypes. Any asana which is centered around belly button is a Pitta into the subtypes. Example being Nokhasana, boat pose, or bridge pose, Setubandha Sarvanga Asana, or say Bhujangasana. A lot of other asanas. Once you understand, is centering the belly button, you can figure it out. Kapha will be they're very grounded. They will need uplifting asanas. They will need a Tadasana, mountain pose. They will need a Gomukhasan, tree pose. They will need a moving Kati Chakrasana, moving meditation. That will be for Kapha. For pranayama, Vata has a shorter inhalation, longer exhalation, but erratic. Because Vata is mobile. Vata's breathing will be... So Vata needs to learn how to close their eyes, quieting down, breathe out first, take a deep breath in, and gently, completely smooth and effortless. Alternate nostril breathing does it for Vata. Pitta, the normal breathing is a long inhalation, very short exhalation. Pitta's normal breathing is... Pitta will learn how to do a longer exhalation. Remember, exhalation is parasympathetic, inhalation is sympathetic. So Pitta will learn more of the cooling pranayama, Sitali pranayama, Sitkari pranayama. Kapha is very congested, grounded, lot of fluid secretion here, very slow moving. Kapha will need an active pranayama, like your Bastrika Pranayama. Very Bastrika Pranayama, active Kapalbhati Pranayama. For meditation, Vata will need a guided meditation. Kapha will need a mantra meditation. Kapha will need a japa meditation. You call it tasbih. You can count the beads. The counting the beads during meditation is in every faith we have. You can call it visually imagery, like a focusing and looking, say, at a flame, or looking, sitting in a beach, looking at the ocean, looking at the sky. Pitta doesn't listen to anybody. Pitta is a king, but Pitta listens to themselves. So Pitta will do a Kebal Kumbhaka, looking inside. Slowly they'll breathe in, they'll bring all the way down to belly button, hold it for a while, Kebal Kumbhaka, and slowly breathe out. Kebal Kumbhaka meditation. Kapha will do moving meditation. Because Kapha, if you get a grounding, they don't want to be grounded, they want Kapha to mobile. So when they're even walking, they're in a meditative walk. Or when they call it Kati Chakras and slowly moving the waist, closing their eyes, following their breath. This is called a moving meditation for Kapha. I don't remember the date, what it is, but if you go to my YouTube channel, all the dates are first, like a 2020, like it will be 2027 and 18. So you'll know it's a year, month and day. And one of the names is Ayurvedic Yoga Therapy, and I have all the descriptions. Next is this is about 30, come to almost 30 Agnis. Next 7 Agnis are called Dhatu Agni. Dhatu is a tissue. Tissue. And again, if you see me, this is one thing, fascinating things I'm telling you. When you are in a proper body and mind union of body, mind and spirit, you do a lot of other things you really don't know. I was doing this thing, movement, and I was doing movement. One time I a little stopped talking. I had no idea I did this. Why? Because in the state of this relaxation response, in the state of your parasympathetic activation, your mind is your software. Body is the hardware. Your mind controls your body. We are a little bit more scientific, so what we say, we also fix both. We fix the hardware and the software both. But if you simply can fix your software, which is very hard to do. So we are, as a human being, we go from bottom high up. We go for your physical wellness, mental wellness, spiritual wellness. But highly spiritual people, they can go top down. They can go spiritual wellness, mental wellness, and physical wellness. So this will happen to you. You'll be doing this thing, you'll be doing this thing, and you'll be doing this thing. You will never know you've been doing it. So I had a question yesterday. I showed them how to do an alternate nostril breathing without closing your nostril. The question came, how is it possible? So I explained to him is that at the level of your 7th limb, the meditative state, that your mind is a software, body is a hardware. Bring your awareness at the belly button, bring your awareness at the nose. Easily you can breathe in through your left nostril, breathe out through your right nostril. Maybe we'll practice even today. You'll see. So for the 7 tissues which are the part of our body, and the yogic concept is that we eat food See, whole Western concept is food is a calorie. Food is an energy. You burn your energy. Think about it. Our whole gastrointestinal tract, starting from a parotid gland all the way up to the anal sphincter, is supplied by parasympathetic nerve. What has happened to me now? Look at my mouth is still wet. I've been talking for 2 hours, but nothing, mouth is still wet. Why? Because of a parasympathetic activation. When you're fearful, when you're afraid, what happens? Your mouth becomes dry. That's a sympathetic overdrive. My body is losing all the tissues. It's called apoptosis, controlled cellular death. It's the same concept of generation, operation, and destruction. Vata, Pitta, and Kapha. Cells, I have a liver cells which being born, liver cell which is maintained, liver cells are dying. It is a very controlled process called apoptosis. I don't eat a piece of liver to make my liver cells. I don't eat a piece of kidney to make my kidney cells. I eat this piece of bread, I eat a little bit of veggie, I eat whatever is the dietary regime for a region or a country or for a culture. I eat that. Russians are different, Germans are different, Mexicans are different. But that food is converted into your tissues. Plasma, red blood cell, muscle tissue, fat tissue, bones and joints, nervous tissue, reproductive tissue, then forms called ojas. So there is an Agni for each tissue. And the beginning of the Agni is your JATHAR Agni in the stomach. When you ignite the JATHAR Agni, the JATHAR Agni slowly and slowly takes over, and by doing the JATHAR Agni in a Kapalbhati Pranayama in very slow sequence way, you develop manasthir. Your mind starts becoming in a stillness. When the mind gets into the stillness, all the Agnis of the tissues, it starts to ignite in sequence. Now say we talk about all the time obesity. Obesity is due to called poor Agni, Manda Agni. In obesity what happens? Food is transferring into your plasma, Rashadhatu, red blood cell, Raktadhatu, muscle tissue, Mamsadhatu, then fatty tissue, Medadhatu. Because of the poor Agni, it does not progress anymore to Astidhatu, bones and just Majjadhatu, nervous tissue, and Shukradhatu. So if you see people who are obese, they come up to the fatty level. And then see what happens when they start forming the fat in the body. The bones and joints does not develop much. They get a lot of osteoarthritis, a lot of bones and joints problem. Neurological disorder takes place because nervous tissue doesn't work properly. They develop peripheral neuropathy, they develop multiple sclerosis, a lot of multiple neurological problems. Then their reproductive tissue doesn't form, Shukradhatu. They have infertility. The reproductive power goes down. So beautiful way of describing in yogic way how to take care of your obesity. Ignite your Agni. Ignite your Agni, that is the way you ignite the Saptadhatu, 7 tissue, from fat to the bones and joints, to the nervous, to the reproductive tissue. Stillness of the mind brings all the Agnis. Now comes 37 Agnis now. You have 3 more Agnis. Agnis of your excreta. Agnis of your excreta, the first excreta is your bowel movement. If you maintain an yogic lifestyle, yogic dinacharya, keep a glass of water in a room temperature. I have it here. Here it is. Use a copper cup. There is a lot of discussion about the copper. So I keep it one in the copper, keep a glass of water. Before going to bed, I keep it on my nightstand. Wake up in the morning, the first thing I do for my proper igniting my Agni, radiance of my proper elimination, Agni of my Mala. I sit down in a squatting pose. I relax myself. I put my fingers here, and then relaxing here, I will be holding the glass of water, and I'll drink the water in a gulp. Drink the water in a gulp. We call it eat water or drink water. There's a Bengali audience here who look at, they know. Amra jol khabo, pani khabo, pani panna khabo. So when you do that, after I will separate my fingers. When you separate your fingers, fingers gets relaxed. If you extend your wrist, gets relaxed. You put your one elbow inside, other elbow inside. Slowly bring it close to you. You can separate more and more. And keep your spine straight, eyes closed. You sit down. Within a very short time, you have a urge to go for a defecation, bowel movement. Why? It's so relaxed. Your pelvic sphincter get relaxed. There is a kink in the anorectal junction between your anal canal and the rectum called a puborectal sling. Puborectal sling goes away, it becomes straight. You'll go to the bowel movement, and I've showed to you, you'll sit down like this in a commode. You can put it's called a squatty potty. Put your fist squatty potty, it comes in 6 inches and 9 inches, and you'll have a proper bowel movement. It is a wonderful igniting your Agni during your first thing in the morning. Copper has a lot of yogic and Ayurvedic significance. We can talk about it. Next time we'll talk about maybe with the copper. For your proper elimination of the urine, you get a bladder function. Bladder function gets very well with your Varun Mudra. There's a Varun Mudra and a Kapalbhati Pranayama. Also to improve your pelvic function, you do call your root lock, Mula Bandh. In a Mula Bandh, you do your abdominal lock. The way you do your abdominal lock, breathe out first, take a deep breath in, completely breathe out, then completely do your contraction of your pelvic floor with anal sphincter and pull it up and hold it. So Mula Bandh. In Western medicine, you also use a part of it. It's called a Kegel maneuver. In a Kegel maneuver, it is also done for your urinary incontinence. And you can do all three together, which is called the Mahabandh. It's the same concept. If you look at one time, my hand is in a Adhi Mudra. I breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach and hold. Contract your pelvic floor and pull it up. Then drop your chin down, touch your chin to the chest, and stay here. Mahabandh. Finally, the last one is the Agni for your sweat, perspiration. Perspiration is called the mala of your prana. When prana is properly flowing, your perspiration is very clean. There's no smell. Remember one thing, proper sign of digestion. No smell in your excreta. Stool doesn't smell, urine doesn't smell, perspiration doesn't smell. Alternate nostril breathing with a little breath holding. It's called Nadi Shuddhi Pranayama. So you have all done an alternate nostril breathing. So let's do an alternate nostril breathing with a breath holding. Then we'll finish with a meditative alternate nostril breathing without closing your nostril. So this year, Nadi Shuddhi Pranayama with a Kumbhaka. When you breathe in, it's called Puroka. When you hold the breath, it's called Kumbhaka. When you hold the breath in inhalation, which is called retention, it's called Abhantarin Kubhak. And exhalation is called Rechak. And when you hold the breath in exhalation, it's called suspension, it's called Vajra Kumbhak. And we do a ratio is 1:4:2. That's just to show one cycle, how to do it. 4 seconds in, 16 seconds hold, 8 seconds out. When you do it more and more, then you can do 5 in, 20 hold, 10 out, 6 in, 24. We can do even a 10 in, 40 hold, 20 out. Okay. So right hand, do a Vishnu Mudra, put your index finger and middle finger down, touch your little finger, ring finger and thumb. Put a pinch and put a pinch in your nostril. Breathe out through your left nostril. Breathe in through your left nostril with a count of 4 in. Hold your breath with a count of 16. Breathe out through the right nostril with a count of 8 out. Breathe in through the right nostril with a count of 4 in. Hold your breath, count of 16. Breathe out through the left nostril with a count of 8 out. Nadi Shuddhi Pranayama for proper opening of your channels, nadis. You do it, keep on doing it effortlessly. Let's finish with what is almost impossible to do, but in yoga says in stages, impossible become possible. Touch your index finger and thumb, Dhyana Mudra, Jnana Mudra. Close your eyes, keep your spine straight. Bring your awareness at your nostril. Without closing the other nostril, breathe out through your left nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through your right nostril. Breathe out through your left nostril. I can clearly see I'm breathing through my left nostril. I'm breathing out through the right nostril. Keep your eyes closed. Bring your awareness in the breath. Keep doing it. Just let's do it a few more times. But at home you do it a little longer and longer for your proper breathing. But I'm showing you the technique, how to do it. And do it enough long time, your mind quiets down. But for me, for the last 2 hours, my mind was quiet. I still have saliva in my mouth. It's a good sign. Slowly bring your hands in front of you. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Padma Mudra. It connects your body, mind and spirit. Gives you wellness. Slowly bring it close to your heart. Heart is the site of the soul. We have practiced yoga therapy for inner radiance. Agni. 40 types of Agni. You can ignite, balance. Sama Agni. Balancing. You create a health. Memorize this. This maybe sounds like a little bit of a Greek and Latin initially, but make a lot of sense. Samadosa, Sama-agnika, Samadhatu malakriya, Prashanna atta indriyaman, Shasthu iti abhidhayate. Bring your hand against in front of your heart chakra and finish with another palming and cupping. Rub your hands, rub your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Put your hands over your eyes like a cup. Let the eyes take all the heat from your hand. Massage your forehead, massage your eyes, massage your face and the back of your ear, front of your ear, tragus, auricle, external auditory canal. Bring it to the neck, massage your carotid sinuses, massage your back. It's a wonderful experience. This is your yoga therapy to ignite your Agni, your inner radiance. And also, so maybe take a look at it, what we'll do for the next Saturday. Maybe with your request, we'll do the yoga therapy to balance your three bodies, gross body, subtle body, causal body, balance your 5 koshas, balance your 7 chakras. Thank you again for staying with us. There is a lot of information here, but I'm passing all the information to my next generation yoga teachers, both yogi and yoginis, to use it and to improve health and healing of our community. Thank you again. A lot of comments, questions. I'll be answering all of them one by one.